Hello there and welcome to my podcast. My name is Brett Lovins and today I'm going to talk to Kyle Zimmer. He's the Health and Safety Director for the International Union of Operating Engineers, Local 478. According to their website, they have a little more than 4,000 members. He's been involved with recovery-friendly workplace issues for many years. In particular, he's sounds like he's really invested in peer recovery work. We cover a lot of topics. He's somebody that I liked right away. I met him in Maryland at the SAMHSA Recovery Friendly Workplace conference that I went to a month or so ago. And I asked him if he would be willing to be on my podcast after we had lunch together one day. And he said yes. So I think it's a great conversation and I hope you enjoy it. Thanks, Kyle, for doing this. Here we go. All right, well, welcome to the podcast and my new friend Kyle here. We met over in Maryland at a health summit at SAMHSA, which I really enjoyed your speech at the front of the auditorium there with all of us recovery friendly workforce folks sitting there listening. And I ran into you by an elevator and talked you into being on my podcast, and here we are.
Strong-arm me than being in the podcast. Come on, Brett. I'm glad to be here. Thank you.
Yeah, well, let's start. I'd love to just open it up and let you kind of introduce yourself to my listening audience, and we'll just kind of go from there.
Okay, great. My name's Kyle Zimmer, and currently I am the Health and Safety Director, Member Assistance Program Director of Local 478, the International Union of Operating Engineers. We started our Members Assistance Program back in 2010 after a workplace tragedy, a very big power plant explosion on a new power plant that they were building in Middletown, Connecticut, and 6 trade workers lost their life. I responded in 2 capacities, and this is important for you to understand how we got to where we're at today. I have a background since I was 14 years old in the fire service. Here in South Windsor, Connecticut, I started as a cadet, and still, all these years later, I'm still involved as a commissioner. But for a number of years, I was also involved with the Urban Search and Rescue Team of Connecticut Task Force 1. And so we responded that day in 2 capacities. And when I got up there, I looked at one of our stewards, and he was as white as a ghost. And he just kept saying, it's only a movie. It was just like a movie. It's only a movie. And you know, he obviously suffering from critical incident stress. And, you know, I kind of grew up in that world. You know, when I was 14 in the 70s, there was no such thing as critical incident stress. There was no such thing as critical incident stress debriefings. What you saw, and you had to live with it. And you know, you asked me a little bit about my personal journey, Brett, you know, that, and I had to live with a lot growing up, removing people from all kinds of tragic and traumatic situations. You know, one of my best friends, I pulled up on a car crash one day, and she was in it and she was dead and got hit by a drunk driver. And, you know, that has stuck with me for forever and never really processed it. So, you know, did I drink a lot in the fire service? Yeah, I did. You know, that was part of the culture. You know, we'll get into culture change and everything else. But, you know, it did lead to some testy times in my relationship with my wife and home life and things along that line. You know, as I mentioned to you, there wasn't a lot of treatment centers back then, but, you know, you kind of grew out of it or you didn't. And unfortunately, I've lost a lot of friends that didn't grow out of it and didn't get the treatment or didn't understand what was going on with them. But getting back to how we started our program, you know, that day was the start of it. You know, being a union, we watch out for brothers and sisters, obviously. And the business manager at that time said, you know, we got problems. What are we going to do? And I said, we're going to call in a debriefing team. And I did. Called in a Connecticut State debrief team for critical incident stress, PTSD issues. And the members responded. You know, we're a 3,200 member union of the International Union of Operating Engineers, heavy equipment operators. And the parallel I was finding between fire service and construction workers was incredible. You know, tough guys, stoic people, keeps everything inside. And, you know, I looked at that and I go, maybe I found a real good home here at 478. And I did. And there was a lot of parallels between the fire service and the construction world. So that day, you know, right after we did a critical incident stress debrief, and the guys responded, they liked it. And all of a sudden, I became the go-to guy for workplace issues. And you got to remember, my background in construction safety started in 1979. So I've been around a long time, and I saw a lot of culture changes in both the fire service and both the construction industry. And, you know, again, a lot of different parallels. And once that happened and guys started trusting in me and believing in me, you know, all of a sudden I was thrown in and thrusted into, you know, dealing with failed drug tests, family issues, substance abuse issues, suicide ideology, and mental health issues. And that was in 2010. So we were a little ahead of the curve in starting peer programs. I mean, they were around. They've always been around. Since Bill W. formed AA, you know, that's what AA was, a peer program, you know, brothers and sisters helping brothers and sisters. So we started our program and it grew and you know, we got into the whole EAP, Employee Assistance Program model, and we were finding the utilization wasn't there. So we fired our formal EAP and we brought it in-house. And for the last, you know, 14 plus years, we've been thriving on our members assistance program. So that's how it all started. And, you know, everybody says, how do you build a peer program? And realistically, the roots of the program are very easy. You know, you got to be caring, compassionate, and concerned, and you need to be a good listener and recognize, react, and recommend. You know, if you see somebody on a job site struggling or wherever you may be, you ask that question, hey, are you okay? And then you take it from there and you try to help people where they're at.
So 2010 to 2014, or 2010 to 2024. So were you sober that whole time? I mean, had you already gotten sober at that point?
I was still dabbling a little bit in 2010. I'd grown up a lot in the 80s and 90s. Being a guy in that world, tough guy, you drank a lot, you know, and that's what we did. And then, you know, just the realization of what I was doing. And, you know, here I am all of a sudden trying to help people, but I felt like I was a little bit of a hypocrite, and, you know, it ended and it changed my life. I mean, really changed my life. And the clarity that you get and, you know, just living a good sober life is very rewarding. And then put on top of that, helping other people, it's just great. It was a great combination. And you know, it had changed some of my friends, which wasn't a big deal. And then, you know, changed my lifestyle. Like I said, I probably lost about 80 pounds over the course of the last 10 years at least, and still work out and whatever, you know, and the healthy lifestyle is the way to go. And, you know, I look today at the people that I help with substance use disorders, and the help that is there for them is incredible. You know, like I said, back then we buried a lot. You know, I wasn't a good employee. When I did work for somebody, I bounced back and forth from owning my own businesses to, you know, working for people. And, you know, always was successful and always good. But, you know, I'm better. That's it. It makes you a better person. And now as I end my career, getting to retirement from the union and starting another journey in a few weeks, still in this space, but, you know, I get to really enjoy the family that I really love, you know, and not worried about anything. So that's where I'm at.
Well, I'd like to dig into a couple things. So you've got a populace of people that you've been serving this time, and you've alluded to them. I think you use the word tough guys. You keep things in. So it's a population, and for somebody that would be potentially listening to this podcast, right? That could have been me. Like I might have snuck in to listen to this podcast. I wouldn't have let anybody know that, right?
Right.
And so you also said, meet people where they are. Say a bit more about what it's like to, to break through, or just say a little bit more about what it means to meet people where they are, particularly with people that are more stoic or that I don't need help, I got this, that kind of thing. Anything there that's interesting to you to chat about?
When we first started this journey and you had an impaired worker on the job site or whatever, it was very tough because the stigma was still around recovery and getting help. I remember going to companies talking about, setting up a members assistance program or a workplace peer program, and they threw me out. We don't have that problem here. Well, you do, and one of the big things that I remember working in the construction industry is that if somebody came to work impaired, banged up from the night before or whatever, there was a, protection factor in there. They hide you, and it wasn't a good scenario between the drinking and drugging on construction sites. So meeting people where they are really starts with breaking down the barriers of getting help, because you need to have that trust and ability to get the pathways going where they can get help. And I'll never forget, a couple of years ago during COVID, I was watching a football game and Jim Irsay came on, the owner of the Baltimore Colts, who's had a struggle. He was talking about mental health on a Sunday afternoon, right? Just saying, hey, it's okay to get help, and this is what we're doing. And, here we are watching an NFL game. When I was a kid, it was Marlboro commercials and beer commercials. And now here's a guy talking about mental health. That broke down the stigma like you wouldn't believe. It started to in our industry, because if it's okay for them to say they're not okay, maybe I can look for help. The other thing is once you help somebody, I always say this to a worker when I help somebody, and they're doing well in recovery. They come out of, whether it's inpatient, outpatient, I don't care what kind of treatment you go to, but they're stable, they're thinking clear. I always say to them, somewhere, some way, somehow, someday, somebody's going to come up to you and just ask this question: how'd you do it? How did you do it? And that's when you become a peer. That's when you put that hat on and you recognized it, you reacted, and now you start to say, hey, if I did it, you can do it. Find out what the issues are and start them on the pathway to recovery. That's the true definition of a grassroots program. And, it's worked. It's worked. I think it makes the person doing that, I know for me, it's made me a better person, helping people and seeing them grow and seeing them enjoy things that they haven't enjoyed for a long time. And seeing them on a job site, seeing them in a meeting, seeing them in a store and say, hey, brother, how are you? And they give you a hug and they say, thanks, man. And I always look at them and I said, thank you. Thank you for doing what you did. I'm proud of you, and it was funny. I just wrote a friend of mine who was one of the first gentlemen I worked with in 2014. He was in a bad way, and he really embraced recovery and is doing well. He's on a job site now, and he just posted a text this morning about his recovery. And, I just texted him back, said, so proud of you, man. Love you, brother. It's just, that's what it's about. Building relationships and it can't be everybody's best friend, but boy, I got a lot of them, and I enjoy it.
Well, I'm going to take a stab at something you said a minute ago. So I'm going to propose this idea to you and see what you think. So, in 12-step work, there's this 12th step, which is basically the last step that says, hey, go help people. Mm-hmm. I don't know about you, but I don't need that step there. I can't help it, right? And I'll also say this and let you take a swing at it a little bit here is, if and when that scenario you just painted, where you got the guy who's gets that question, who's put a little time under his belt, who's like, enjoying a sober life, and somebody comes up to him and says, "Hey, how'd you do it?" Or "Can I talk to you?" I'm going to propose to you that person that opened their mouth and said that to their ear, that is a massive moment.
Absolutely.
That's a window of opportunity that may be so freaking fleeting, because I don't know about you, but I dug a moat and a chain link fence, and then I had barbed wire, and everything was lit up with electricity to protect anybody from touching the precious, using Gollum terms there.
Yeah. Yeah.
And so if somebody were to say that, it means that they've cut through some things to get to that moment, and how profound that moment can be. Over to you.
So when somebody says that, there are a few reasons why they say it. Number one, they recognize the issue that they're going through. Okay. There isn't a man or woman that I've worked with substance use disorder that, once the light bulb goes on, hasn't said to me, "I wish I had done this earlier." Never. So how do you get there? A good, very close clinical friend of mine who was in recovery, Jerry Marcel, who actually, I'll talk about Jerry in a little bit, remind me. But he said to me one day, and I know this is in the clinical workbook. First of all, I'm not a clinical guy. I'm a pure man. I'll get you there. You close the door and you go from there. He said to me, there's only 3 ways people get sober. He says, medically, legally, or their own willpower. They want to. They want to enjoy the journey. And the barrier there on the last one always has been, in the workplace anyway, stigma. I'm going to lose my job. I'm going to get blackballed. I can't provide for my family. So this is how I've got to live. And that's not true anymore. And where the paradigm really shifted was the opioid crisis. And, God forbid if anything good came out of the opioid crisis, was people were opening up because they were struggling and they were looking for help. And that's continued. It's continued. So, when it's okay not to be okay, and people realize it, and people start to process in their minds, I guess, what the rest of their life is going to look like, a lot of light bulbs go on. And, there's just so many different ways of accomplishing that now. You're a 12-step guy, right? And that the 12-step program, there's one word there that, in those groups that really said it all until recently, is anonymous. Whether it's, Alcoholics Anonymous, Narcotics Anonymous, Al-Anon, you were driven underground. And it's amazing the presentations that I give, anywhere from 10 people to 200 people at a time or more. And when I'm done with the talk, I'll come up and say, "Hey, thank you for that. I'm celebrating 30 years, or I'm celebrating 25 years, or I'm celebrating 10 or a year, whatever." People don't have to be anonymous anymore. A good friend of mine, I don't know if you know Greg Williams at all. He did the film Anonymous People. And he did it when it wasn't cool, and you had Chris Herron in it. You had other, Chris Herron resonated with me a lot, the basketball player. But that really, he threw that out there, and it really got some play, and it helped a lot of people. And then his group, Facing Addiction, which is no longer around, but they were on the cusp of breaking the stigma. And I can say I'm very proud in 2015 that I was part of that. They did an inaugural concert on the Ellipse in Washington, D.C. in the middle of a hurricane. But, you had Sheryl Crow, Steven Tyler, Jason Isbell, you name it, show up, who are all in recovery from the music world, which, I respect a lot, because they continue doing what they're doing, and they're proud of their recovery. That was the start of breaking down stigma on a big, big scale. And then you see it just continuing, following up. And then the opioid crisis hit, and those companies that I referenced before that were throwing me out because they didn't want to talk about it, all of a sudden we're losing key personnel. The families were infected. They were affected personally, whether it was a son, daughter, cousin, brother, whatever, and then they started to try to understand the problem as much as they could to make changes. And, I'm blessed that people like myself that do workplace peer work and have been doing it for a while were there to help, to pick up the mantle a little bit and to spread the word,
Yeah, I'm a big believer that having examples, like you use the word stigma or normalize is another word that I love to put into this bucket, right? Like for me, I work for a giant multinational corporation, which we talked about over lunch a little bit there, right? I worked there 12 years and I knew nobody in recovery, maybe one.
Yeah.
And as soon as I became a voice and got loud and became an example, they came out of the woodwork. They're everywhere.
Yep.
And not to beat up on the word anonymous, because I know it has an important thing and an important place, but that movie that you referred to is on my website. I love that movie. I share that. Even the trailer is great. And it's like we're the anonymous people, like, because for years nobody knew. Why is that? And now that I'm comfortable with it, my own journey in that regard, there's so many of us. And then when somebody sees that from a distance or up close and they realize, wow, this is interesting, right? Curiosity shows up, and now we got a different ballgame, in my opinion.
Yep.
But until you can get to that curiosity and this awareness that there's opportunities and there's different people doing it different ways, et cetera, man, you're just all by yourself doing that stuff, and it's no good.
And, I was very humbled this week when I went to the White House to talk about this in workplace, recovery-friendly workplace roundtable that the White House had. And, there were 14 business and labor leaders sitting around the table talking to Rahul Gupta, the director of the Office of National Office Drug Policy. It's a big, long name. And Tom Cordair from SAMHSA, and their staff. And we're talking about how we're going to continue to grow this. And, one thing that I always say is, and my research friends are not going to like what I have to say now, but we don't need any more data. We need workers. We need people out there doing peer work in the workplace, because the resources that, NIOSH have developed, and CDC and SAMHSA, and, the material's there. Everything's there to put in place a good workplace peer program. I'm fortunate enough to be a member of the National Building Trades Association, NAPTO, and North American Building Trades Unions. And, we're pushing workplace peers on construction sites all the time, get trained. And peer programs look so different. They can be very formal, or they can be very informal. They can be, one person in a company or 100 people in a company. It doesn't make any difference as long as the message is out there. Help is available, and we'll get you to help.
Love it. Well, I gotta ask you more about the time you spent at the White House, because I saw a couple LinkedIn posts that you were one of the people there. Though I never saw a photo of you. They haven't. Maybe you snuck out of the
one. I'll send you one.
Okay. I thought maybe you snuck out of the frames when the
camera. No, there's one that the AFL-CIO is throwing around with me in it. So I'll send you that after we're done.
Okay, awesome. Well, so you're sitting there. You said about 15 people. What are the questions? I mean, are you privy to be able to share a little bit about that conversation?
Oh, yeah, it was very open, very public. I have them right here. We had Director Gupta's Labor Secretary, Lisa Gomez, who, having somebody from the Department of Labor there is huge, because under the Department of Labor, two agencies that I deal with pretty much exclusively in the health and safety world is OSHA and MSHA, Occupational Safety and Health Administration, and Mine Safety and Health. I know where you're at, and you have Washington State OSHA, which is very progressive and very good. I've done some work with them. But, to have the secretary there talking about what the Department of Labor is looking at doing. And OSHA finally recognizing this as a workplace hazard because of workplace impairment, fatalities, and everything else. And that's a message that I've been trying to get OSHA to recognize for 14, 15 years. And they're finally doing it. And, when you look at the safety realm of things, you always look at electrical hazards, slip, trips, and falls, struck by and caught in between. Those are the four pigeonholes that OSHA has always put injuries in from day one of OSHA, which was in 1972 when the OSH Act was signed. And then they never updated it. When we were building our program, myself, the programs coordinator, who will be stepping into my role when I retire, Ashley Dwyer, and a very good friend of mine from the industry, Marco Carr, who's a big advocate. We were sitting in my office and said, we need a hook. And they both looked at me and I said, what's the hook? What's a hook? I said, well, when we start talking about our membership, construction workers, what are the things that they relate to? Well, I said, safety. They'll listen to safety. They may not look like they're listening about safety, but they are. Right. So make this a safety issue because you know what? Almost every accident to the T that I have investigated since I was a loss control rep at the Hartford Insurance Group to my days in the union, there's some form of impairment, whether it's physical impairment or mental impairment, physical meaning drunk or high at work, and mental impairment of, hey, Brett, you got to go to work in an hour. Oh, shit, I haven't slept all night. I was worried about my son, my wife, my daughter, my friends, my this, blah, blah. It doesn't make any difference. And you go to work and you're mentally impaired, and it's called presenteeism. And you're not there doing the job that you're supposed to be doing. You're thinking about everything else but what you're doing. And presenteeism probably kills and hurts more people than anything else on a job site or in the workplace, both industry and construction. And, people always say, well, what's presenteeism like? I said, okay, driving down the highway, you're supposed to get off at that next exit. What do? Drive right by. That's presenteeism. You're thinking about something else, either subconsciously or consciously. So that's one thing that we really need to work on with the agencies like OSHA and MSHA, and looking at the data from accidents. And we're starting to see that now. They're starting to accept data from autopsies, from accident investigations, from post-accident drug testing. All that stuff was buried for years. Now it's starting to come out a little bit. And hopefully in the next few years, you'll start seeing that being used to support my argument on being impaired at work. Mine and others, a lot of others. But getting back to the White House, Secretary Lisa Gomez was there. Tom Cordair from SAMHSA was there. And the findings from Forest Marsh, that organization that presented at the SAMHSA event, they had another thing with HR and how many HR professionals know about recovery-friendly workplaces, and very little, like 6% maybe or less, have any idea what's going on. So they gave that finding. And then we went around the table and we had people from Thermocool, Gorilla Glue, Associated Building Contractors, myself from the International Union of Operating Engineers, Steve Romero from United Auto Workers, who gave a very good presentation on what the industry's doing, and just a whole bunch of us sitting there talking about what each individual person is doing, and then bringing it back around to, how can we tie this into more policies, really. And a lot of people don't like to hear that, but we need it. We need it. And we got to really start figuring out how we're going to guide people to recovery-friendly workplaces, how to, again, continue to remove the stigma and give people the opportunities for recovery that they need. And, one thing that I did quote, which came out of thin air, and I kind of like it the way it came out, was when I was asked what's the definition of a workplace peer, I guess. And I said, the ability to give the rank and file workers the power to help. And that's all it is. Real simple. Give the workers the power to help. If somebody needs a day off and you can cover for them, give them that day off so they can have a mental health day. They can go to their meeting. One thing that I'm very proud of in Connecticut and that our have embraced, not 100%, but the major ones have, is giving people time off during the work week to go to counseling, to go to a meeting, to do this, to do that, within reason. And it works. It works.
Well, we're cruising through some great topics here, Kyle. So you mentioned, I made a note here. Do you want to because you dropped a cliffhanger in, so you did that. So who's Jerry Moselle, and talk a little bit about that.
Jerry Marcel is a person that I met in 2010 when we were starting the program. So I found a group called the Labor Assistance Professionals, or LAP. Primarily organized union peers that do work in this space and have been doing so since the mid-90s. And, they have an organization that does provide some training, that organizations like Ford, the airlines, now the construction industry, have gone through LAP training, and we all become labor assistance professionals certified, going through peer type training. And I met Jerry. He was the EAP for Pratt Whitney, and he retired, and he started his own. He during his time at Pratt, he went and got the clinical degrees and licensed drug and alcohol counselor, and started his own firm. And through the LAP organization, I met Jerry, and we clicked. The mindsets were the same. And he opened up, and I can only describe Jerry as a country doctor, somebody that really cares, meet you where you're at, and when I say that, I mean physically. He'll get in his car and drive to where you're at. And, he just relates. He's easy to talk to and gives good advice. He was the main reason we fired and saved money in our health fund. You got to understand, Local 478 and a lot of trade unions are self-insured. We're an ERISA plan, Taft-Hartley plan, and we have our own mini insurance company. So we were paying a provider a lot of money a year to have a less than 1% utilization, but we had to provide it. So at one of the board of trustees meetings I sit on, I said, look, we got to do something. And the executive director of the funds, we all agreed that, this is crazy. And Jerry took the opportunity, came in to Local 478, and we have him on retainer. So we have a full-time licensed clinician available to all the union members, retirees, and families, 24/7, 365 days a year. And his staff has grown to 3 clinicians now. So, I can pick up the phone now and say, Jerry, I got a guy in crisis. Okay, give me his number. I'll call him right away. Or we work together. We get him on the phone together. Getting people into treatment has just become so easy. I mean, you develop some relationships with a few local and not so local treatment centers, and before you know it, when you make the call, we got a bed. Or if it's an IOP, Jerry can handle it. Or if they're not comfortable with Jerry, we can find another clinician. It just makes it so easy. And again, when somebody calls for help and they made that decision, okay, it's my turn, and you get an 800 number and please hold, and what's your zip code? Here's 6 providers. You got to make the call. No, that doesn't cut it. You lose those people right away. You've got to be able to respond within minutes. One of my best stories is last Christmas Eve, I got a call from one of our members who I knew was struggling. And the grandfather called me and said, he's here. I think we got to talk to him right away. And I went up to the house Christmas Eve. And within 20 minutes, Jerry had him on the phone. We had him going into a facility that night on Christmas Eve. Now the kid's out working. He looks great. He's happy. He's healthy and, well on his way. But those are the type of things that confront people every day and they don't know how to handle it. And so we got to make the tools. That's what I made that pitch on Wednesday. We got to make the tools available, and we got to make it at the grassroots level. And because sometimes people get into training, okay, I want to be a peer, and they get lost in the minutia of it. Really, what is our goal? What's our goal on a peer? Get people the help. I'm not a clinician, never have been, never will be. I did sleep at a Holiday Inn, but, don't expect me to solve your problem. I'll help you, but I'm not that guy. And that's a true peer.
Yeah. Yeah. That moment that you just, a little bit ago, that person who talks to the other person, that moment when somebody says, hey, I want to talk to you about this thing that's, anybody that's been in recovery a while, and we all have our journeys of when we opened our mouths, right? When we started going beyond, at least I call it my small voice, right? My small voice that was working on me, but that was right here, right between my ears. And man, those moments when those people open up and what happens next is absolutely critical. And having a safe ear, somebody who's ready, like you said, not to fix it, right? Because that's misguided, but to be an ear and then to help them toward what's going to work for them, right?
Every time I train peers now, I say, you're on the road, you're on a journey, and what's there to protect you from going off of that road? People look at me, what are you talking about? I say, I'm talking about guardrails. I say, you got to set up personal guardrails as a peer to keep your focus on getting the people help. There's too many times I've seen peers get drawn into something they shouldn't be.
Yeah, and I think that most corporations get uncomfortable with that too, and that's one of the things that was sort of
that's a barrier. Yeah,
it was a huge barrier. And once it was clear that nobody was going to be giving medical advice, that we were able to point at our EAP and our different medical opportunities. But to what you said a little bit ago, the EAP utilization, though I never saw the number, I think that many times companies think, well, low utilization number means
it's better. Yeah, no.
It's the opposite. And that's what I was trying to advocate. Like, low EAP numbers is a red flag. It's flashing red. So do you concur with that analysis?
Absolutely. Again, when a coworker talks to another coworker and they ask that question, how'd you do it? And I went to see our union's guy, Jerry. Yeah, you ever see Better Call Saul? We should get T-shirts made up, Better Call Jerry, because that's what it is. He has a rapport with the guys and they know him. The best advertisement for an effective peer program or internal EAP program is the people that have been through it. And that's what's happening, and as time goes on, the pyramid effect is there, reverse pyramid, you start small, but then you end up big, you grow it from the bottom up and you save lives.
Yeah. Well, I'm really digging this conversation. I enjoyed your speech at the event as well. So thank you for the work you're doing too. One of the things that's perplexed me is, and you touched on a little bit ago, is, this recovery-friendly workplace movement. It rolls off my tongue, right? It's commonplace to me, but it's not that long ago that it wasn't. And I just had a fairly recent opportunity to speak to a group of HR professionals at a large company, very progressive, very caring, thoughtful, et cetera. And at the conclusion of it, I came away realizing that isn't rolling off tongues of people that are in the business of HR. So I see a huge opportunity for HR professionals, companies, et cetera, EAPs even, because our EAP had some trouble as well. I see huge opportunity, and I want to be a part of an advocacy to make that happen. I don't know exactly how that works. I see things, I'm aware of some mechanisms. I see people like me that are starting to approach companies and say, we did it here, you can do it too, kind of a thing. Let me add one more thing to it and then over to you. Is one of the things that I took away from that conference the most was from Vicki at Shaw Industries.
Yeah, she was at the White House also.
One of the things that really jumped out from that whole event was what she said was they've got different business units and they're all unique in that it's not a one size fits all. And you got to approach them again back to where they are. So love your thoughts on advocating for recovery friendly workplaces and how we can get louder. And also this idea that there's not a right way and that the police aren't at the door to take away everybody's booze and that kind of thing, but instead to enroll and make it safe to get help. What do you think about that?
Yeah. And I mean, when you build programs, they either go one or two ways, right? They come from the top down or the bottom up. With recovery friendly, it needs to be a combination. It needs to be a combination. And companies that I've worked with, especially in the construction industry, the construction industry and industry overall, it's pretty micromanaged when you look at it. And it all comes down to what? Dollars. So what's our benefit going to be, right? What's our benefit? What's the return on the investment? And advocates never really like that because, it's kind of like the man watching you or whatever. But we've got to understand, people in recovery got to understand that they own a business. We're the workforce. Without them, we don't exist. Without us, they have problems existing, right? So we really need to marry the two. And the return on investment can be our biggest advocate, our biggest selling point for a recovery-friendly workplace, especially for those that don't know anything about recovery. But again, the data is starting to come and show what peers and support and effective programs are giving you back. So for every dollar you spend, is it 4, 5, 6, 7, 8? I don't know. But it's not a negative, I'll tell you that. So you should always look on the positive side. It's $2, $2. If it's $8, $8. It's still better than losing it. With losing people, having to retrain, cost of accidents. I mean, we got insurance companies now looking at this, okay? Which I'm not a fan of insurance companies, but they're a necessary evil. But they're looking at this and they're saying, just like in 1979, let's go back. We'll talk about culture change if you want.
Love it.
Culture change comes slow in industry and construction, right? In the workplace. Comes very slow. In 1979, when I entered the construction world on a different level as a loss control rep for the Hartford, where you go out and you do safety type stuff, our biggest challenge in 1979 was to get people to wear hard hats, high visibility clothing, glasses, gloves, and boots, okay? And we were met with every argument that you could conceive. Oh, it's too heavy. It's going to hurt my neck. I'm going to, catch the levers on the machine, on my vest. This is blah, 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 on and on and on. Well, people got used to it. Now you go to job site, get out of your truck. What's the first thing you do? Put on high vis, this and that. People give away T-shirts, high vis. It saved lives. It really did. The data proved it. Then we move into the early 80s, and we had another big problem with falls. So what did we do? We invented fall protection, right? Not the optimal, but it worked. People stopped falling to their death on construction sites in industrial settings, and it worked. Then we had the ergonomics culture change in healthcare and factories and construction sites. It all worked. And then we got into leadership training with job hazard analysis. Look at the job that you're doing, analyze how you do it, and see if you can recognize the hazards before. But nobody ever picked up on the lifestyle issues. Suicide rates are 6 times national average in construction. Mental health is utilizations through the roof, and substance abuse. We're still losing 10,000 people in America every year to it, right? Now we're picking up on that, and we're equating it, going back to safety, back into workplace issues. That's how you sell it to companies. And people are starting to listen now, especially when you get some data. National Safety Council, you heard them at that seminar. They're starting to come up with some data on what it costs and where accidents are happening and overdose deaths are happening, on and on and on. let's take a look at the Narcan or the naloxone distribution in the workplace. That's removing stigma. That's opening up talks. I started distributing naloxone in Connecticut in 2023 in November. I did my first training. And probably had 15 people in there. I had to beg them to take the box home. I said, yeah, no, it's yours. It's free. The state's providing this, I did a training 2 weeks ago on a job site with probably 30 people, company people, management people. I had 30 people physically in the room, and I went through 15 cases of 12 naloxone. Can I have a case? Can I do, it's not taking one or two anymore. It's, can I have a case? I belong to a motorcycle club. My soccer club wants it. I'm going to give it to the neighbors. I don't care where you put it. It saves lives, right? And it opens up conversations.
Culture change, big time.
Culture change again.
Yeah. Well, yeah, we're watching the naloxone thing has been amazing over the last year to see that whole thing completely change.
And it started with community advocacy groups, taking care of the people that, need it and recovery or whatever. But there are two different levels here. Now we got it in the workplace. You got an AED in your workplace, you should have naloxone right next to it. Right. And chances are you're going to use the naloxone more than you're going to use the AED.
Right. Well, I'd love to circle back on the money thing, and we'll maybe start to head towards the exit here. So the NSC, and I'll put a link in the show notes. National Safety Council has a calculator that's been around a while for the substance use disorder, and I know that I have a lot of HR people that listen to this podcast, and hoping you're listening again today. And what I'd love to propose to you and let you run with a little bit is I believe, at least in IT. It is true that there is a door someplace, there is a computer, there are some people that can see potential KPIs, key performance index measurements. And what I found is when I would approach from the money angle and I would give things like the NSC calculator and I would, say, this is how much you're saving, et cetera. It has been my experience that there's a blankness that comes over the person's face because they're so used to it. This is my proposal to you. They're so used to that hidden tax that it seems like an apparition. What you're saying isn't true. And my advocacy or my suggestion to you is pick five KPIs. It doesn't really like whoever has access to those numbers, pick 5 or pick 3 or maybe you even have some suggestions on ones to pick, and then do some things and see the results. Because I am a build, measure, learn guy through and through, and I'm a data guy. And it's one thing to do this for the kindness and for the right thing and to be part of a culture change, et cetera. But if the company can't see the return on investment, then the longevity of it is in jeopardy. And I'm curious what you're seeing or what you think of what I'm proposing here, which is we got to get some KPIs in play. We got a company has to have some key performance numbers to be looking at as they make changes so they can actually see those dollars as opposed to, best guess.
I guess looking back on it now, going back a little ways, a lot of what we're talking about was built around the opioid crisis, right? And that name opioid crisis stuck, but that's the tip of the iceberg. That's a very small piece of the problem. So I think one of the things that you need to do is to break that barrier through. Listen, it's not just opioids, because the first thing a company owner will tell you, oh, we don't have that problem here, or it's a one-off or two-off or whatever, or don't you see the numbers are coming down? But when you talk about it as a whole, the whole lifestyle issue to make your people better, to put in a wellness program, to put in all kinds of alternative programs that we've been talking about for years, total worker health. And you bring it around to that. And, you make changes to your damn traditional safety programs where you start to bring those up to date and then you put everything in a big bow with a package, and you have healthier friend workplaces, and the relationships that are there are much healthier than they were before. Now, the key point indexes, I think you need to look at. I haven't really thought about them a lot, but I think I'm hitting on them about total worker health, looking at the way things are being done in the workplace and how you can improve. The industries that we work in, total worker health is a NIOSH program, as you know. Jamie Osborne did a presentation at SAMHSA. And I got a company to try total worker health here in Connecticut. And one of the things that I told the person from NIOSH that was coming out to the site, because you're looking at sleep deprivation and fatigue in the workplace. And I said to her, I says, one thing you need to do is not mention sleep deprivation or fatigue, please, because construction historically is built on overtime and long hours and long seasons. And, that's what it is. Okay, but I think you're wrong. I says, I may be, but if you want to have a discussion, we need to keep it apart. She said, okay. So the first huddle that we did, we had about 10 workers around in a circle. And she says, tell me anything that you want about your job that if you could change it, you would. Legitimate question, right? What do you think the first one said? Too many hours. I don't have time to go to my kid's soccer team, blah, blah, blah. And it opened up, Pandora's box. And she just wryly smiled at me and said, I told you. And, I get it. And we went back and we had a debrief with the company, and we said, this is the number one issue that your workforce has right now. It's trying to change the culture to make them happier and healthier. And the company said, okay, we'll work on that. We'll do some cross-training. We'll make arrangements so they can have some time off. And, because they work, from February to November, and then they have a few months off. And that's when you're supposed to take care of yourself and go on vacation and do it. Well, it doesn't work for everybody, right? So, things like that, I think we really need to get companies to look at. So it's a friendly workplace, not a recovery-friendly workplace. It's a friendly workplace, a worker-friendly workplace, because, again, the words opioid, recovery, with the narrow-mindedness of some people, we don't have that problem here. You do. Let's change the nomenclature. Let's change the wording a little bit and get you on board.
Great conversation. Enjoyed our chat very much, Kyle. There were many things in there that I think are super interesting, including this idea that you got to be grassroots as well as from the top down when it comes to recovery-friendly workplace work. And gosh, I'm just super impressed with the work you've done and all the lives you've touched along the way. It's got to be just massive. So thank you for the work you do. Thanks to all my listeners. Feel free to, follow links to my website, brettlevens.com, and send me a note if you'd like. And until next time, take care.